The following presentation outlines information on basic cardiac OR setup as it is done at the Brigham and Women's Hospital. Please be aware that the setup might be different at your institution. You should start in a stepwise fashion, making sure that you have a working suction, perform standard anesthesia machine checkout, and have all necessary airway equipment, including a large 8.0 or 8.5 endotracheal tube. The equipment in a cardiac OR includes standard ASA monitors plus the following devices: triple transducer with pressure bag, with red transducer corresponding to arterial line, yellow transducer corresponding to PA catheter, and blue one to CVP monitoring. Head of the bed setup includes defibrillator pads, which are located in the OR supply cabinet, defibrillator 3-lead EKG, and standard 5-lead EKG. You may also place a gel pad as a cushion under patient's head. Equipment in the pocket of the right pole includes fibrillator and pacer. Make sure that you test batteries for the pacer and test fibrillator for power to ensure that both devices will work properly during the case. Defibrillator is located on the right side of the bed and is usually tested by the nursing staff. But please make sure that the cable is connected to the defibrillator pads placed on patient. Cardiac anesthesia cards are different, so familiarize yourself with the drawers. Cardiac non-controlled medications are in the top drawer and include most of resuscitation medications that may be needed during the case. You may have to obtain them from pharmacy for the first case of the day. On top of the cart, place the medications that will be needed for beginning stages of the case. If possible, fill out the medication request sheet and leave it at the pharmacy the night before scheduled surgery so that the medications will be ready for pickup, saving you time in the morning. The requested medications may vary depending on patient's past medical history and planned surgery. However, the usual induction syringes include standard emergency syringes of phenylephrine, ephedrine, atropine, and succinylcholine, and additional syringes for fentanyl, propofol, oritomidate, non-depolarizing neuromuscular blocking agent, esmolol, phenylephrine diluted to 40 mics per ml concentration, epinephrine diluted to 8 mics per ml or 4 mics per ml concentration, and nitroglycerin diluted to 40 mics per ml concentration. Also, confirm presence of heparin in your cardiac kit and place it on the top of the cart as well. Some extra medications that can be kept on the side wing of the blue cart include albumin, but only if your attending has specified its use, cardiac drips in premixed bags of phenylephrine 320 mics per ml, epinephrine 16 mics per ml, and norepinephrine 32 mics per ml. Aminocaproic acid or tranexamic acid, again only if your attending has specified its use, insulin drip, and antibiotics, which for cardiac cases usually include vancomycin and cefazolin, administered based on patient's weight. On the left pole, you can set up the fluid warmer and 4-channel Alaris pump. You may organize your infusions in whichever way makes sense to you. Here we have an example from the left of Amicar infusion, VIP line, which is a vasoactive infusion port with 1 liter Normosol on microdrip with a gang of 4, and cefazolin. On the right pole, you can set up your bolus line with 1 liter Normosol on half of Walrus tubing attached to gang of 4. Central line will be placed in patient after induction. You can set up a tray with all necessary supplies that include 4 triple lumen catheter, multi-lumen CVC kit, Mayo stent cover, 1 sterile half sheet, 1 set of gloves, gown, probe cover for ultrasound, central line dressing kit, and 2 sterile flushes. Depending on the case, you may be told that patient needs central venous access via cordis with a slick. Cordis is an introducer sheath that can be used for rapid volume delivery during resuscitation or for subsequent placement of a Swan-Ganz catheter. Slick is a single lumen infusion catheter. However, most often in clinical practice, it refers to triple lumen catheter that locks into the top of a cordis. Please discuss with your attending what central line access is needed for the case and set up accordingly. Thank you very much for watching, and good luck!